Go ahead, Amy.
I'm Amy Muell, and I work for a nonprofit organization dedicated to helping children and families who struggle with mental health issues such as ADHD, depression, anxiety.
And how long have you been working in the field, Amy?
Since 2004, I have my LCSW, which is Licensed Clinical Social Worker.
Now, you're in private practice. How are students often referred to you?
They're usually referred to our agency by state caseworkers who are legal guardians for children that have become state wards in the foster care system.
How do you help with ADHD?
What I do is I determine the symptoms of the child's current functioning, and I look at ADHD symptoms as well as anxiety symptoms because both of them are very similar, and then usually refer on to a psychiatrist for medication management if that's determined necessary for the child. Otherwise, if parents want to stick with more behavioral approaches and not using medication, then we will try behavioral approaches.
So you see that students on a regular therapy type basis?
Usually I see children or adolescents once a week, depending on the need of the child or the family.
My overall goal with the interview is to help guide teachers in the classrooms on working with students with ADHD. What kinds of accommodations for students in general in ADHD do you think would be helpful for school teachers?
I think learning about the different research out there on ADHD would be helpful. Learning how to teach these children is a big piece of it. A lot of these children come in and they just cannot be taught like regular kids or non-ADD, ADHD kids, and so learning new techniques is definitely going to be important.
All right. Can you give them a technique or two that you find very helpful?
Keeping them busy, on task, and structured at all times.
So maybe providing a para or having them sit close so
Yes.
you can keep reminding them to be on task.
Having at least a couple different things. Maybe they need something in their hands to play with, or they need pencil and paper to write with, because they can focus on so many different things and still hear that they can do those pieces.
Well, thank you, Amy.
Thank you.
Okay.